Шановні колеги, будемо продовжувати роботу українського кризового медіації.
Dear colleagues, we continue our work of the Ukrainian Crisis Media Center, and current our briefing is devoted to the topic: how can children get advice at the National Hotline for Children? We have Oksana Niherovich, representative of the UNICEF Foundation in Ukraine, Ruslan Kolbasa, Director of Department for Children's Rights and Adoption, Minister of Social Policy, and Levchenko. Dear participants of today's event, thank you for coming to this event. As one of the organizers, I would like to give the floor to our partner organization, to Ms. Oksana Oleferovich, who represents the UNICEF in Ukraine, and to thank for support of our National Children's Hotline. Thank you. I'm very pleased to hear so many people interested in this topic in this room. Thank you for your interest to our activities and activities of our partners and the whole work which we carry out for the sake of children of Ukraine. The Children's Fund UNICEF in Ukraine was founded in Kiev in 1997, and since that time we deal with improving children's lives here in Ukraine for almost 20 years now. The reason why we decided to support this current project was rather grave due to the conflict in the East. Many children and many families with children found and demonstrated new needs in services. We have 5 offices in the regions, in the regions in Oblast which suffered most from the conflict. And in order to support children and families in the most suffering oblasts in Ukraine, we organized a series of programs, a series of events. One of such programs was devoted to strengthening awareness of school workers, which was opened for teachers, for school psychologists, for parents, and for senior school students. Due to this program, we will be able to provide assistance to 300,000 children in the east of Ukraine and in central part of Ukraine. Also, we have established the foundation for support of families, which deliver services to the suffering communities in the east of Ukraine. Services are delivered to children. We organize consultations and advisory events for children. We organize some events. We organize collective games for them. And this allows children to return to the situation and environment of real childhood instead of wars around them. Also, we have a network of partners providing consultancy in psychosocial area. Also, we try to reach those people who reside in remote or rural areas where there is huge deficit of psychologists and advisory specialists. This network is especially important for so-called gray zone. In this gray zone, we have 16 mobile brigades for support of families, and they delivered assistance to more than 250,000 adults and children, members of families in the so-called gray area. Nevertheless, we still have issues with medical, psychological, and social aid to people residing in those areas in the East. Each time when we travel to the East, we hear from our partners that there is still a high degree of demand. The IDPs who arrive from other regions, when they come to normal life, nevertheless, at later stages, we found out that they require psychosocial assistance. There is a high level of anxiety among children, a higher level of aggression among children. These are signals that there is still much space for our works. That's why we are very grateful to our Strada partners who joined us to provide hotline services and to advise children via telephone consultations. Strada is only one, Strada for children is only one hotline which is available for children all around Ukraine. This program was launched by us jointly with Strada back in 2015. And last year, Strada received more than 35,000 calls from children, not to mention adults and family calls. By the end of October, this was almost this year, by the end of October, we had 30,000 of calls. So the trend preserves, despite the fact that not all children managed to dial us, to reach us, because our technical capacity is limited, but nevertheless, this is a huge figure, and this is big assistance on behalf of this organization. Another important component of our work this year was development of standard operational procedure, and immediately after me, my colleagues will describe it in more detail. At this very moment, I would like to emphasize that developing this standard operational procedure would become the first step in building up a more broader network of hotlines, and it is a good example of partnership, first step to public-private partnership. In future, we hope that in the future the government will procure this service from civil society organizations, and that this will become an important element in the state policy as to the protection of Ukrainian children. With this, I would like to give the floor to my colleagues. Thank you, Oksana. Now I would like to give the floor to our big strategic partner, to the Ministry of social policy. To Mr. Ruslan Kolbasa, 2 years ago, we have concluded with the ministry an agreement about cooperation, and we have development joint action plan to implement this agreement. We continue our cooperation rather successfully. I'm very grateful for this work. Thank you very much. First of all, I would like to thank to our organizers who will present today the outcome of our work. I would like to thank to UNICEF for all the assistance in implementation of joint programs. Actually, due to the UNICEF support, we are able to cover and to implement a wide range of problems. The issue of hotlines had been being raised for a rather long period of times. We had long discussions how to apply hotlines for children in Ukraine. We discussed the format, the number of employees and those hotlines. This was discussed by multiple working groups. We also involved some international European experience. And eventually, I'm very grateful to this organization, which is a civil society organization, and nevertheless runs this hotline dealing with children's problems. Quite often, these are emergency calls or just ordinary consultancy services to children in their problems in relations with their fellow classmates or relations with parents. This work also allows us to understand better existent problems of children. Today we will present standard procedures. In Europe, hotlines are multiple. There could be not just one hotline working for working at the national level. There could be different lines, but they are all standardized. How many employees there should be? What are the general response procedures for each worker of such hotline? I'm very grateful to the support from UNICEF and to support of Strada. As of today, this is a civil society organizations which deliver this assistance. While receiving calls is only first step, then this information should be delivered further in order to get proper response to children's services, to maybe teachers if there is a problem at school, etc. So the issue was how to normalize the work, how to put it into some procedural order. Several times, having presented the project of Strada, this hotline project of Strada, we see that their work finds better and better response with time, better and better response from the counterparts on sites. So in order to make this project even more smooth, we needed standard procedures for bringing in order all social services delivered to children at the local level. I'm grateful to all our partners, and I'm very proud about the work which we have done jointly with you. I think that together we will contribute to protection of children's rights at very good level.
So the presentation of the document we worked for and gathered today several words about it. You know that this hotline for children is the only one in Ukraine. It started its work in 2013, and calls made by children or about children, we received this call even previously before that, and we saw the need in this hotline, the need of children to communicate with someone, to get answers they cannot resolve, or the questions they cannot pose at home or at school. So this hotline was separated, and this line that is in Ukraine is full-fledged member of such hotlines for children. The members are from 141 countries of the world, and UNICEF is a strategic partner of this international association and supports. UNICEF supports the activity of Hotline for Children in Ukraine and in many countries of the world. And last week we had 8 consultations of the hotlines for children in Strada attended, and this meeting was in Bangkok, Thailand, and at the conference they adopted Bangkok Declaration. And in this declaration, the declaration envisages that there are many challenges, and among them, the lack of efficient interaction, formal interaction and non-formal interaction with entities that provide assistance to children. And this is a challenge not only in our country, but throughout the world. And as recommendation that is provided in this declaration is to reinforce the work and to conclude contracts, protocols with appropriate structures, organizations, state organizations that provide this help to children. So we are going in the trend that exist in the world, and according to the needs we have. Statistics, we may say that in 2015, the members of the network answered 15 million calls from children and about children. If you're speaking about our hotline, starting 1st January till now, we got 38.5 thousand calls. And the statistics show that the number of calls increase. And despite, as you said, Oksana, the number of hours of hotline reduces, but the number of calls increases. And we all understand that Hotline for Children is the first step of a child to get access to national network of protection of children, and the consultants of the hotline, they are like guides for this child in the system, because children, they do not know where to address to, what documents to provide. So consultants of the hotline can assist in this. Speaking about international statistics, each 7th call in the world concerns the violence, and you can see it in the graphs we provided in the materials. For further help, the help is not limited by consultations through hotline. Children who are in difficult situation or suffer from violence and abuse. They need help that is provided by different organizations, both state organizations and private organizations, and in order to provide such further help and unify and standardize this interaction, our document was developed that we are going to present. The project of standard operational procedures was developed together with the Ministry of Social Policy. They actively provided their comments. The Ministry of Education and Science of Ukraine, National Police, and the Ministry of Healthcare, and we are grateful for your active participation and comments that you provided. All your comments and propositions were included in this document. On the whole, standard operational procedures are the algorithm of actions directed to implement future standards of provision of help of this hotline. So the standard operational procedures that we have now, so these are first steps to standardizing the activity of hotline on the whole. The end aim of all the organizations that are involved in helping children who are in difficult situations, is provision of such needed help. If we are speaking about standard operational procedures, they consist of 3 main blocks. First, so guiding principles, based on principles of cooperation between the entities. Among the principles, we can cite provision of best interests of the child, the right to express freely opinion, urgency, and continuity. And this block is important because it has the function of minimum level of standards that should be provided in the process of helping these children. And from one side, these principles are the principles that standard procedures are based on, and they help to form the line of conduct of all the entities included in this help to children. And the second part, the second block, is terminology that is used, and this terminology is formed based on international standards concerning defense of rights of children, and also our national legislation. Third block, standard operational procedures, the list of actions of entities that identify what actions and in what sequence should be done by the subjects, by the entities in different situations to help children. So the description of such procedures include first identification of the case, starting from the moment when the child called to consult, and the consultant started to listen what the child is going to say. So then the interview through the hotline, and completion of the form, then assessment of risks, the degree of the risk of the situation, whether the referral is needed, and the information about rights. The child is informed about his or her rights and how to protect the rights, and also the consultation with the experts in case if such consultation is needed, and the formulation of the problem and the result of all above mentioned actions. What is going on with the child, what the problem is, and then there is referral According to the situation, there will be the referral to proper organization where this child will be able to get assistance. And important aspect in this operational procedure is the monitoring of the case, how this help is provided, whether it was provided, or it should end, or it should continue for some time. You have all these standard operational procedures. You can see this document in your materials. And one of the key questions, what are the plans for the future? What will be next? So as of today, the document is ready. It is important to use this document in practice, these procedures, and introduce the norms that are in this document, to implement them in real life, and to provide help to children. This document will be printed, and in the framework of the project that we have with UNICEF, it is planned to train how to use the standard operational procedures by consultants of the National Hotline for Children and the regional specialists of all the structures that were participated in the development of such standards, and that are the entities who provide help to children. I'm really grateful for your attention, so please, you can ask questions or you provide your comments. Do you have questions or comments? Okay, introduce yourself first. Любомира Клink, рядовой курьер. Could you tell us, could you name the organizations to which the children are referred to? Are these organizations NGOs or ministries? What are they? And are there any cases when some organization refused to get this referral? And what was their argumentation for refusal? Or do you follow what this referral end in? So thank you very much. This is a good question. So we refer children or parents or people who call with some problems concerning kids. Usually we refer and we address, as Ruslan Sergeyevich told us, to the service for children and to police. And in Ukraine we have proper legislation and order in what way the entities that provide help to children have to react in case of violence or abuse of children. I can say that starting from the start of our activity, there were some problematic aspects of response because there were a lot of calls and all the information that we got that, for example, some children were abused, all this information needs to be verified, and the representative of social services carry out this verification, or police officers can do this. Could you add? You know, I would like to say that so when we plan to establish a whole hotline for children, so we believe that this should be a state institution, and in some time we had problems. So how the services that protect rights of children react? How do they react? So we needed time in order to coordinate our activity. The issue of state hotline for children, this issue is secondary because we have a good example when we discussed whether we should create a state line or we should use the public resource to the maximum. One of the example, there were events in Maidan, and they say that a child that was in Maidan. The services, social services came there to reveal such kid, but there were calls from children, and they said maybe these children won't call to state hotline. Maybe there would be some mistrust. And for example, if children and teenagers, they came to Maidan, they expressed their position, and maybe they won't trust this hotline, that is state hotline. That's why we showed it as an example. And also, if we develop and support hotline of civil society organizations that have trust among people, there should be a mechanism how our services will react. So we have the agreement with the ministry, and the letters were sent to the social services. And you know that information that is provided from Hotline for Children, this information should be properly dealt with. The services, they should verify the information. And this is a social service and social service for children. They provide social support, and the child who phones, they are held by the social services because there are some problems in the family, and there should be structures, institutions that should respond, and the interaction between the entities is needed in order not to have violations in the sphere. So social services and national police are involved, right? Depending on the call. So if it is an emergency, of course this is police, and as statistics show, emergency calls is about 2%, and in the majority of cases, these are consultations for children and parents. So maybe services that deal with matters concerning children or social services. Thank you. The Ministry of Education, Nina Berezina. I would like to add, as Olga said, the number of calls to the hotline for children increases, and the ministry disseminated the information about the activity of such national hotline for children, and this is we supported the activity of this hotline and disseminated information throughout the educational institutions through the letters of the ministry with the request and recommendations that they should provide information to kids about it, and also about if, for example, a child at school can ask for help of psychologists. So outside institutions, a child can be helpless, and at home a child should know how to act and where to find protection. And further, our teachers, they know about this. We will have a conference tomorrow on actions against abuse and violence against kids. We invited La Strada in order that they provided information, and we use this in our activity. We understand the problematic issues in child's life and what aspects we should pay attention to if the problem arises. Thank you, Nina Alexeyevna.
You're right. Educational institutions are really important source of information, source of raising children's awareness about us, and schools receive handouts about our activity and spread it among children. chief pediatrist of the Ministry of Health in case of any problems with health condition. Whether you contact any healthcare services, and the second related question, whether you have cooperation with youth clinics. Thank you for your question. We are very grateful that the Ministry of Health was engaged to this work at the stage of standardizing procedures. By now, we had no cooperation with the healthcare organizations. Sometimes we have calls from children when they inform about healthcare problems, and we explain where they can address. As for youth clinics, we have a huge network, more than 140 youth clinics. This is a rather old long-term project of UNICEF from 1990s in Ukraine. We should contact them, these clinics. I think we should develop partnership in this direction. And in Kiev, in Akhmedit, we have a special monitoring center for services delivered to youth and children. Maybe we should contact and establish cooperation. If you will help us, we will establish this cooperation. I'm from the Ministry of Social Policy. We have a joint order of the Ministry of Social Policy, Ministry of Internal Affairs, Ministry of Healthcare, about cruel treatment with children, and it describes what could be done in this respect. Thank you, dear colleagues. You have a possibility to discuss the problems in the lobby with the coffee and networking. Thank you.